KNUST-TEK TV. Experience educational television.
The German West African Center for Global Health and Pandemic Prevention, G-Wac, held a launch for a network of modulars for pandemic preparedness and response at the Mastercard Conference Room, KNUST, on the 27th September 2024. The theme for the launch was Modeling for Pandemic Preparedness and Response, which aimed at developing tools to respond to pandemics in Africa and the world at large. The launch marked the end of the 2-week modeling certificate short course, which trained medical scholars and professionals worldwide about how to create tools to respond to pandemics in Africa. In attendance were lecturers, professors, researchers, policymakers, and practitioners in the health, veterinary, and environmental sectors with diverse backgrounds from Africa. Senior lecturer for the Department of Medical Diagnostics, College of Health Sciences, KNUST, Dr. Michael Owusu, gave the welcome address on behalf of the director for G-Wac, Dr. John Amwesi.
G-Wac is a German West African Center for Global Health and Pandemic Prevention. It's a center that has been established in KNUST through funding mostly from the German government through other sponsors. We were set up to support pandemic prevention and also pandemic preparedness. We have about 5 blocks. We have blocks in public health. We have blocks in virology diagnostics. We have blocks in veterinary medicine. We have blocks in community health. And almost all the areas that come together to prepare us to, in order to respond to pandemics. We have these groups available. So programs like this falls within the scope of G-Wac to enable us train health professionals and other non-health professionals to gain the skills, the knowledge to be able to respond.
The provost of the College of Health Science, KNUST, Professor Christian Ajari, also gave an opening remark urging the participants of this short modeling course to spread and multiply the knowledge, skills, and experience received from their training.
I'm happy that G-Wac is living up to its mandate. So far, they've been doing well based on what participants get from the various training programs and our funders. And I believe that I've been informed that they had more than 200 applications and you were selected. It means that you have something that after this program you can share with your colleagues back home. As you are aware, the continent is plagued with a lot of epidemics, sometimes threatening our health systems. So if you are able to get this opportunity for us to get some knowledge and skills, I believe we are not going to stay in our various offices or departments with the knowledge that we've gotten for the past 5 days or so, but you are going to serve as trainer of trainees. Because when it comes to managing pandemics or preventing pandemics, it's not supposed to be a one unit or one person approach. It's more a multifaceted approach.
Following the success of the training, participants were awarded certificates and a toast for the future growth of the project was given by Dr. John Amwesi. Researcher and facilitator for the short course, Dr. James Azam, gave a brief presentation on achievements made by the participants during the short course.
If you remember from my presentation today, and also we all know that the Mpox outbreak is ongoing. It's growing every day, by the day in the DRC, and it's spreading across East Africa and jumping into other countries. And we need modeling capacity, for example, to respond to this. When COVID ended, we thought it was over, but it wasn't. And Mpox is the new child in the block. And we need to care about that. And one way to do that is to use models, because mathematical models are a cheap way to study things like interventions. If we wanted to study different types of interventions like vaccines and all of that, you cannot go out, develop vaccines, try it on people, find out if it works before you proceed to roll it out. But models are a way to encode all these ideas into your computer and use that to ask alternative questions. What would happen if we closed down schools? What would happen if we closed down hospitals? And that's what models can do.
He applauded all the participants for their contribution during the period of the training. The director for G-Wac, Dr. John Amwesi, in an interview with Tech TV said that the short course aimed at bringing together young researchers from across Africa to receive training on mathematical modeling, an integral part of pandemic prevention.
So this course is essentially serving as the launch of a network of mathematical modelers who will operate within G-Wac. It's one of several that we hope to prosecute in the coming years. It's really just the beginning of what we think will be something that will blossom continent-wide, so that we have health professionals who appreciate modeling, who can at least conduct basic modeling or provide the critical information which modelers will need to be able to develop and utilize models that will be useful in pandemic prevention.
A researcher in field epidemiology and applied biostatistics, Mr. Shadrach Minta, also gave an account of the training, stating some achievements and discoveries made in the course of the program.
Started with modeling for different pandemic and how it operates or how it flows. So we first started by looking at how COVID-19, the pandemic, was modeled using SIR models. When you talk about SIR models, we are looking at how the disease starts with the S compartment, which is the susceptible, and the I compartment, which is the infected compartment, into the R compartment, which is the recovered or the removed compartment.
The launch was climaxed with a dinner and a socialization session for participants to network. Tech TV News interacted with some facilitators and participants after the program.
G-Wac was established in the year 2021 in response to the COVID-19. The German government, through the German Academic Exchange Service, DAAD, funded the establishment of 5 global centers, and KNUST was fortunate to get a grant to establish German West African Center for Global Pandemic Prevention and Preparedness.
G-Wac, which is the German West African Center for Global Health and Pandemic Prevention, is focused on education and research. So training the next generation of researchers in global health who will be able to focus on pertinent questions related to preventing pandemics.
Tech TV. Experience educational television.